Let's go through a hair loss case and the blood work that I ran on a patient in my practice. For those of you who don't know me, my name is Dr. Brianne Callanan. I'm a naturopathic and functional medicine doctor, and I help individuals get to the root cause of their hair loss. And one of the things that I often do in my private practice is run comprehensive blood work and explain the blood work to patients so that they can understand why their hair loss is occurring. Understanding the root cause is really important because it can help us to differentiate which treatment options are going to be the most effective for this individual. So this was a case of a 42-year-old female. She was experiencing diffuse overall hair shedding, but she also had other symptoms. And this is where it's so important to treat the body as a whole. I ask questions about hormones, digestion, nutrition, mental health to really get a clear understanding of how this individual is doing as a whole. She was experiencing dizziness, also worsening facial hair, weight loss resistance, and she had visited a hormone doctor who had prescribed her HRT. She was on oral progesterone, oral estradiol, testosterone, and phentermine. And phentermine was used for the strategy of trying to lower her weight. So this is what she came with. These are the labs, and we're going to go through some of the things that I picked up that I feel that are contributing to her hair loss and potentially a root cause. And this is exactly what I do with patients in my practice. So before we go through the out of range ones, I always like to start kind of top to bottom and explaining things. Her white blood cells looked great. I am going to go quickly in this video because I want to keep it short and highlight the key players here when it came to this individual's hair loss. This I would take a lot more time with individuals in my practice, but I think this gives you a good idea of how I practice. White blood cells looked good. These are all the different types of white blood cells that make up the total. And then for hair loss, I'm looking at, is this nutrient deficiencies contributing? So I'm looking for things like anemia. Her red blood cells were normal. Her hemoglobin was normal. The size and shapes of her red blood cells were normal. So she is not meeting the definition of being anemic, but you can still have iron deficiency or B12 deficiency without being anemic, and that can impact the hair. The other thing that we want to do, and this is going to become important in this video, is look at blood work from an optimal perspective, especially when it comes to hair growth. So she wasn't anemic at this point in time, but as we can see further down, she did have some nutritional deficiencies. In terms of her blood glucose is higher than I would optimally like to see it. I like to see it around 75 to 85. Whenever I start to see some elevations in blood glucose, I'm starting to think, does this individual have insulin resistance? Insulin resistance comes before prediabetes, and it can contribute and be a root cause for hair loss as well. Her fasting blood sugar was higher than I like to see it, but it has come down with the phentermine and doing the diet and lifestyle that is helping to support her blood sugar, helping to support weight loss. But it's still not where we optimally want to see it. Kidneys, liver, that all looked great. In terms of her cholesterol panel, one of the things that I like to focus on is HDL. I call this the happy cholesterol. This is the one that you want high. Her HDL is fine at 41, but I do feel that there's some areas that we can improve upon. Think walnut, chia seeds, omega-3s in your diet, fatty fish like salmon. The other thing I pay attention to is I take the triglycerides and calculate a triglyceride HDL ratio. This can also give us some clues into whether or not insulin resistance is present. When we look at her triglyceride HDL ratio, it is 2.4. It is getting better compared to her first blood work that she ran, but there is still some insulin resistance here. Insulin resistance can lead to inflammation, elevated blood sugar, inflammation. That can contribute to hair loss. In addition, when insulin levels are higher, insulin resistance is present. This is often at the root cause of androgenic alopecia. The two most common hair loss patterns that I see in my practice are either telogen effluvium. That's usually diffuse overall hair shedding. It either comes in waves where you see a significant shed and it gets better. Oftentimes, telogen effluvium happens from nutrient deficiencies or a stressor, whether it's a trauma or a move or a change in your relationships. Something has caused stress on the body that we see hair loss. The other most common type of hair loss that I see in my practice is androgenic alopecia. This is hair loss that normally packs the part line as well as the temples, and it's gradual and progressive over time. Androgenic alopecia, some women could also experience acne with that, hair growth on the face, as well as hair growth in other areas that otherwise wouldn't be appropriate for women to see, and irregular cycles. So the purpose of this blood work and the consult that I did with this individual is looking at, do you have telogen effluvium, nutrient deficiencies? Is this androgenic alopecia? Where are your hormones? Is it the insulin resistance that's raising the hormones? And really helping to describe so the individual can understand exactly what's going on. She does have some insulin resistance, which I do feel is contributing to some of the hormone related hair loss that she is seeing. In terms of her thyroid, this all looks great. Her thyroid antibodies were not elevated. Perhaps the free T3 is a little bit lower than we otherwise would like to see it, but I don't think this is low enough that's contributing to her hair loss. And there's other more important things that we want to address first. Her B12 and folate looked great. Her zinc levels look great. Her C-reactive protein was quite high. This could be due to inflammations because of the elevated blood sugar and the insulin resistance. It could be perhaps she was fighting a cold or flu. She was coming off the tail end of the cold at that point in time. So that could raise the level. But regardless, we want to ask, what is the root cause of this inflammation? I did recommend a turmeric curcumin supplement for her to get the inflammation under control. While we work on the blood sugar piece, the insulin resistance, so this inflammation also can come down. Now, when you have hair loss, you can have hormones contributing to your hair loss and nutrient deficiencies contributing to your hair loss at the same time. It doesn't have to be one or the other. When we looked at her iron panel, what I noticed is that her ferritin levels are low. She does have adequate iron in the blood. The transport proteins are appropriately saturated. Her iron saturation is 27. But ferritin is more important to look at because this is the storage form of iron. The American Association of Family Physicians says anything under 50 for a ferritin is iron deficiency anemia or probable iron deficiency anemia. There are other guidelines, such as in Ontario, Canada, where ferritin really should be 100 to be considered normal. When ferritin is below 40, I definitely see increased hair shedding. For good hair growth, I like to see a ferritin 70 to 100. So this is something that we need to address. She was not getting adequate dietary sources of iron, so we recommended an iron supplement. And we want to repeat this ferritin levels in 3 months' time to make sure that that supplement is working and corrected the issue. We can also observe her hair loss over time. Is your hair loss getting better with the iron? Is the dizziness improving with the iron supplement? And repeating those labs can be really helpful in determining whether or not our treatment plan is working. When it comes to things like prolactin, prolactin can cause hair loss when it's elevated. Hers was normal. In terms of her hormones, she is on hormone replacement therapy. These levels are appropriate given the time that we had her go do the blood work with respect to her menstrual cycle. Now, the interesting thing with the oral estrogen is she was getting some headaches with it. Oral estrogen is more likely to cause those symptoms versus other forms of estrogen in terms of the administration, like topicals or patches. Right now, she's going to leave her HRT where it is, but we did talk about perhaps providing some DIM support to help her body metabolize and detoxify those estrogens more appropriately. When we look at her androgen levels, the quote unquote male hormones, things like DHEA, testosterone, dihydrotestosterone. If those are elevated, they can definitely contribute to hair loss, but we also have to remember that each individual has a different sensitivity to androgen levels. So just because your blood levels are normal does not exclude androgenic alopecia. She was also experiencing hair loss on the face. That is another symptom that leads us to think perhaps androgens are a factor here. Her DHEA was fine. Cortisol, the stress hormone, when it's high, can cause some hair loss. Her labs were within the normal range. When we looked at her testosterone, her free testosterone, and her dihydrotestosterone, she is using testosterone as part of her testosterone replacement therapy or hormone replacement therapy. It was recommended by her hormone specialist to increase her levels of testosterone. I am always cautious in overdoing testosterone. Testosterone is a wonderful hormone. It helps with muscle mass, libido, confidence, motivation, energy, can help with mental health concerns such as depression. But if you overdo testosterone, you can see worsening of hair growth in the face and hair loss on the head. Some individuals will take testosterone and actively convert it to DHT or dihydrotestosterone. This is the super testosterone that can cause hair loss. The rate in which an individual converts testosterone to dihydrotestosterone is genetically determined. This is why male and female pattern hair loss, we often ask for a family history to see how your mom, dad, grandparents' hair loss is. If everybody fits the same pattern, it's more likely that it's male or female pattern hair loss, which has a genetic determinant to it. But just because you have a genetic predisposition to convert your testosterone to dihydrotestosterone does not mean that there's not things that we can do to address this. One of the major contributing factors to androgenic alopecia, or this hormone-related hair loss, is insulin resistance. Insulin can increase testosterone levels. Insulin can increase free testosterone levels by lowering the liver's production of something called sex hormone binding globulin. These details don't necessarily matter, but anytime I see insulin resistance and slightly higher levels of DHT paired with the symptom of hair loss, acne, or hair growth on the face, it does seem more probable that the androgens are a concern for this individual. Insulin resistance can also impact receptors at the level of the hair follicle. It can increase DHT receptor expression. So now you have more receptors that are going to bind onto the elevations in DHT, contributing to more miniaturization. The hair goes into the resting phase sooner, the hair follicles get smaller, and we see premature hair loss as a result. This individual needs to be really cautious with her testosterone replacement therapy because it does appear that her testosterone is more actively converted to dihydrotestosterone. Now, in terms of some of the treatment options, one, we have to fix the root cause. We have to fix the insulin resistance piece of it. She does have iron deficiency. We need to address that for overall good circulation and hair growth and energy. And potentially that could even help with her dizziness sensation. The interesting thing is her blood sugar and her insulin is getting better. We also saw her triglycerides and her LDL are going down. So what she is currently doing from her diet and lifestyle perspective is working. And I always say to individuals, our bodies do not have an Amazon Prime overnight shipping option. Sometimes it can just take a little bit more time and a little bit more consistency for insulin resistance to get under control. If she wanted to speed up things in terms of how quickly the insulin resistance is being addressed, she could consider something like berberine. Berberine is great for insulin resistance, lowering hemoglobin A1C, lowering the fasting insulin, as well as berberine may have some anti-androgen properties as well. From a topical perspective, she could consider a ketoconazole shampoo to block the DHT at the level of the scalp. This could be something like the Nizoral shampoo, where you leave it on the scalp for 5 minutes, 2 to 3 times a week, and then wash it out. When we look at, okay, what are the strategies for lowering DHT? One, fix the insulin resistance, be very cautious with your testosterone replacement therapy. Two, you could consider incorporating things in like saw palmetto, nettles, zinc, spearmint, ECGC from green tea, zinc, reishi, lycopene, and vitamin B6. And there's many combination products that we can use that contain therapeutic levels of all those ingredients, and you take that. For some individuals working on the blood sugar piece and the supplements, the herbal natural option does wonders for them. For other individuals, it's not going to be strong enough, and they may need some prescription medications that have stronger actions in inhibiting the DHT. The stronger medications for inhibiting the DHT do have the potential for some side effects and are not indicated or right for everybody. Her thyroid antibodies were normal, her vitamin D looked great, and her magnesium levels look great. So I think there's two contributing factors in this case. Number one, the insulin resistance is likely elevating the androgens, and the DHT is probably causing some of the hair loss. She also has iron deficiency anemia. Sorry, she has iron deficiency without anemia. But I have seen in many, many patients that a ferritin less than 100 contributes to shedding as well as poor hair growth. So this is where we're taking a holistic approach. Diet and lifestyle for the insulin resistance piece, perhaps some berberine. She's working with her hormone doctor on her hormones. That's fine. That's great. But we may want to add in some DIM around 200 milligrams for the estrogen detox piece if she is getting those headaches, or switch to a topical estrogen or the patch. In addition, it does seem that she has this predisposition to transferring her testosterone to DHT. She needs to be really cautious on the dose with testosterone replacement therapy, and she may benefit from some natural inhibitors of DHT, whether we're inhibiting the DHT receptor expression or we're preventing the testosterone from being converted with DHT, or there are medication options. In my one-on-one consults, I will go through this more slowly. I will type everything up. I will show a lot of pictures for individuals to understand. And then I'll write out what the research says for the natural treatment options versus the pharmaceutical options so that individuals can make an informed choice on which treatment option they feel is best for them. So I hope that gives you an idea of things to look for on your blood work, interpreting things from an optimal perspective, not just a normal perspective. And if you are interested in getting your blood work done or setting up a one-on-one consult, within the comments below, there'll be all the links to my private practice. I hope that was helpful.